Autism or autism spectrum disorder refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. Once considered rare, the current understanding of autism is that it is in fact one of the most common developmental diseases. At Medicircle, we are presenting World Autism Day Awareness Series, for which we are going to feature eminent pediatric neurologists, speech therapists, and clinical psychologists through which we aim to build a better awareness of the signs, symptoms, and realities of autism. Hi, I'm Sana Khan, and today our guest for the talk is Dr. Shilpa Jasubhai. Dr. Shilpa is a consultant clinical psychologist and independent researcher who is currently affiliated with Zydus, Shalby, and AIMS hospitals, while also consulting to Sandesh Press and Micah in Ahmedabad, Gujarat. She has been practicing in the field for over 15 years now. She has been contributing to the development of the field with several published papers and being a speaker in India and globally. Recently, she received an International Leadership Award as an innovative researcher from RULA in association with United World Council and United Medical Council, and a Remarkable Researcher Award of the Year under ISSN Golden Research Prize. Hi, Dr. Shilpa. Welcome to Medicircle.
Hi.
How are you?
Thank you. I'm good. Thank you so much.
Okay, Dr. Shilpa, how is autism diagnosed, and is there a specific test for it?
Basically, autism spectrum disorder is a developmental disorder, and it affects the nervous system. Okay. And basically, it hinders the cognitive, emotional, social, and physical growth of a child. Right. According to the latest DSM-5, there are 5 subtypes of autism spectrum disorder. We're not going into the detail of that, right. But basically there are a number of developmental screening tests available in the market. Right. I basically fundamentally use CARS, which is a Children Autism Rating Scale. It identifies a child with the autism and it determines the severity of the symptoms. Right. But before going to a professional, there are certain, the symptoms, the early signs that parents can observe in their children. Okay. At home. So let's look at them one by one. Right. Please. The first is when the child doesn't respond or with a smile or, with facial expression by the age of 6 months. Okay. Second, doesn't respond to sound or doesn't mimic to sound or the facial expressions by age of 9 months. Okay. And doesn't babble or coo or even respond when the child is called by his name by the age of 1 year. Okay. The gesture when the child is around 14 months, they use fingers or they use gestures or they point at things, they wave. But that doesn't happen when the child is early symptoms is one of the symptoms where the child is not able to wave or gesture or point at an object by the age of 14 months. Okay. The child doesn't say a single word by the age of 16 months. Okay. In the childhood, we play make believe or pretending games.
Pretend play.
Yeah, right. So when the child is not playing make believe or pretend games by the age of 18 months, okay. And by the age of 2 years, if the child doesn't utter 2 phrase words, that is also an early sign. Okay. Avoids eye contact and wants to be alone most of the time. Mm-hmm. Gets upset with minor change, if the child if you're putting the child even the glass in a particular position when the child is sitting on the table, if it is changed, if it is put somewhere else little different, the child will get upset with that. They're not able to adopt to minor changes also. Okay. They have difficulty understanding others' expressions, others' emotions, or even express their own emotions. Right. There is a delay in the speech. and even in communication skills also. Then sometimes they may repeat a particular word constantly or a phrase,
Right.
and they have a peculiar habit also, like flapping hands,
Right.
rocking back and forth, or even going spinning themselves in circles. When you observe that, they are also an early sign of autism. Then they have a very unusual reaction to the way things sound or feel or even look or smell or taste. For example, when there is like whistle of engine or even a special pressure cooker whistle,
Right.
they'll close their ears.
Okay.
Or the firecracker, a
Is
lot
it
of time
because,
I've observed that,
okay, is it
like, a lot
because
of time they
they
are not
don't
able
like
to, they're sensitive to sound.
okay, they become very sensitive to sound. Okay.
Yeah. So very, very shriek voice and
Right.
volume, they're not able to adopt to that.
Mm-hmm.
Sometimes even food also, so they like particular food, how it tastes in the mouth. So they prefer to eat that food constantly.
Right.
So these are the typical early signs which parents, if they look into it, there will be they can help the child much earlier and not wait for a later age.
Right.
And normally, the age group of the test that I use, it starts from 2 up. It
Okay.
starts from 2 years and upwards. So earlier, you can screen the child by the age of 2 years.
Okay. So, Dr. Shilpa, what causes autism then?
The cause of autism is not well understood still. The researchers believe that it is a combination of genetical and environmental factors. A few of the causes could be the child having like any other member in the family with autism, or born to very old age parents, I would say around 45, around 45, 50.
Right.
So that is also risky for a child to develop autism. Then when the child is born extremely premature and the weight is very, very low, birth weight is very low,
Right.
maternal obesity or diabetes or immune system disorders, prenatal exposure, when the mother is pregnant, she gets exposed to either pollution or pesticides or even
Right.
toxics or heavy metal, that also affects certain kind of the toxic or the metallic medicines also causes the symptoms in the child,
Okay.
early symptoms. And if the child doesn't get proper oxygen while the child is born, lack of oxygen while the birth can also cause autism. And in I've dealt with a lot of autistic children, and I have observed while taking the history of the mother's pregnancy and all. Most of the time, the mothers have been through very traumatic pregnancy, emotionally stressful pregnancy.
Right.
So that is not yet not scientifically proven, but that is my observation that most of the mothers have passed through that trauma.
Correct.
So I mean, these are the two of the causes that can cause autism.
Right. So it is not proven yet, but we can.
I mean, basically, it is proven in the sense that it is either genetical and environmental, one of the causes.
Correct. So, doctor, what is the best treatment for a child with autism?
So, treatment for an autism is an umbrella term, because under which there are number of therapies a child goes through. So there is no one therapy or the one treatment that fits all. It is structured, or it is designed based on the severity of the symptoms and need of a child.
Right.
So there are a lot of we have a lot of centers or in India, those who offer this kind of treatments.
So it must be depending on the child's development.
yeah, child's development stage and basically the symptoms and the severities of the child's problem.
So there must
So like
therapies for them.
There are a number of therapies, like the child, because there is so many things that child is lacking when an autistic child is there. Child needs so many kind of different help. So first is early intervention. Researchers have shown that when the child is the diagnosis is earlier and intervention also starts earlier, it helps in reducing the symptoms and enhancing the abilities and skills, so that child can at least lead a normal, become independent.
Correct. Right.
So early intervention is also very important. The first treatment is early intervention.
Okay.
So then there is a behavioral management therapy. Okay. So there, they focus on wanted behavior, and they minimizes the unwanted behavior by adopting the behavioral therapy. Right. They also guide parents what to do, and their caregivers to what to do when there is a problematic behavior at home. So they train the parents and the caregivers also. Right. Then there is a cognitive behavioral therapy. Here the therapists, they focus on the emotions and thoughts. So the child learns they learn to identify the thoughts and that which is causing the problematic emotions in them. Right. So by dealing with that, they are able to handle their behavior also. And they basically thought creates emotion, emotion creates thoughts. So it's a vicious circle. Right. So they focus on the child's thought process and emotion. The child learns how to deal with their emotions more healthily, and they help them restructure their thoughts also. Okay. Then there is an occupational therapy. Okay. So which focuses more on the cognitive, physical, social, and motor skills. Okay. Yeah. You were asking something? No. I was just thinking about what other therapies are there. There are a number of therapies. I'm going one by one. Okay. Then there is a play therapy. Play therapy, child plays with a lot of games, a lot of soft toys or the characters and all. So the child develops how to express, how to even the behavior wise also learns proper behavioral skills, how to express, how to communicate with others. All those skills are developed by play therapy. Then there is physical therapy, where a child learns how to balance, strengthen themselves, and even the posture. If you have observed, because the autistic children, their self-esteem is low. So normally, they walk like this. They don't look up and walk. So is it because they don't have that confidence, or because they cannot? It's lack of confidence also, and it's their habitual to walk like that, and they basically develop that kind of a walk, because they don't want to have an eye contact. First of all, the children have eye contact. Correct. So they are unable to concentrate. In fact. Right. Eye contact is we are looking into eye to eye coordination. They don't look into eye to eye. Correct. They don't look into eyes. So when they don't look into eyes, they would prefer to look down and walk. So they develop that kind of posture. And studies have shown, and I have in my practice, I have number of children, even adults have improved their self-esteem by just changing the posture. So if you're walking like this, the moment you put your shoulders back and walk up, your confidence level increases. Correct. Right. So this helps and plus their motor skills, their fine motor skills, all these are developed by physical therapy. Okay. So what we've noticed is what I can relate is what we've seen in Shah Rukh Khan's movie, that the character that he's played in My Name is Khan. If you observe the way he was doing the fingers. And he doesn't give an eye coordination. He doesn't have an eye coordination. Yeah. And he never had eye contact.
and he gets scared of.
Yeah, whenever he was talking to somebody, he was looking here and there,
Right,
and everywhere
correct.
else, but
Yes, yes,
to
yes.
the indirectly to the person.
Correct, correct. And the color, he was scared of the yellow color because of some incident.
Yeah. See, that's what I'm saying, that there's
Correct.
something unusual reaction they have to some things. And another thing is also, I've observed they have some peculiar thing which they are very, very powerful.
Okay.
If you've seen the movie, he was extremely intelligent in the numbers.
Right, correct. He could just remember them.
Yeah, exactly.
Right.
He had a very powerful memory for the
Correct.
numbers.
Yes,
So
yes,
they
I
at
remember.
times they do have, depending on the severity of the symptoms and the disease, so they do have something very peculiar which the parent or the therapist need to find out, so that they
Okay.
can enhance that
That
skill
skill.
in the child.
Right.
Yeah. Sometimes they are very good with numbers. Sometimes they are very good with, the drawing. Actually, drawing is very difficult for them because it's a motor skill.
Motor skills, so
But
it must be difficult for them to hold it.
numbers and even solving puzzles, they're very good at it.
Oh,
A lot of
okay.
time I have seen that they're very good with solving puzzles.
So this
So
this proves that there is nothing wrong with their brain.
it is basically,
It's a
it's not, you can't
developmental
say that
issue,
this.
right? It's just the
Yeah, so
development.
there is something wrong. It's a nervous system problem, like it's a developmental issue. So there is something wrong. The brain is not developed. The areas in the brain for that particular task is not developed.
Correct,
properly.
correct, right. There must be a particular right.
So yeah, the fundamental thing is for parents is to accept the child.
Correct, right.
There is no issue with the child. There's nothing wrong with the child. It's a child is born with certain
Skills and
disabilities.
disabilities.
Yeah.
He might have
Yeah.
some skills that needs to be enhanced
It
and
needs
to
to be
be looked upon.
identified and worked on.
Correct, right.
Then there is nutritional therapy.
Okay.
For variety of reasons, that it is believed that the children don't receive the nutrition they need for their growth and development.
Okay.
Because they prefer to eat certain kind of food, and they are very stubborn. If they don't get it, they throw tantrums.
True.
So they don't get what is needed for their development. And it is proven that avoid preservatives or any artificial colors or artificial sweeteners. That is also very important. Like even in children with hyperactive and attention problem, these three things are normally we avoid because it activates the brain cells.
Okay, that is what did you mention? What should be
the
avoided?
Aggressive behavior. Yeah, so avoid these three things, then it will help in reducing the aggressive behavior in a child.
Okay.
And recent studies have also shown that giving them a gluten-free vegan diet also helps in reducing the symptoms and the behavioral problems.
Oh, okay.
Yeah. So normally give them a lot of poultry, and they need to drink a lot of water.
Okay.
Hydrating, having a lot of fat, like rich, basically a lot of vegetables and fruits and food rich in omega-3 fatty acid. That is also very important. So nutritional, they can see the nutrition and get a proper diet for the child. Then there is basically speech therapy to improve their language. And because it's a delayed speech, so they need to work on the sound and how it is spoken.
To be spoken,
because
right.
They normally by till 5 years they don't say things, they don't talk, they only point fingers at things.
Right.
So then the other is parent mediated therapy. So here the professionals help parents so that they can continue giving the training at home also.
Okay, right.
Child, yeah. So then the child
it get in the routine of the child, right?
Yeah, and they are able to handle the child. Then medication therapy. Actually, there is no medicine to cure autism.
Okay. Okay.
Commonly, healthcare professionals and even the doctors, they give medication for basically for the symptoms or the behavioral behavior that they observe. For
Right.
example, a lot of time children with autism, they have convulsions, they have epilepsy attacks or something. So they give anti-convulsive drugs.
Okay.
They are very hyperactive and they might have the obsessive compulsive behavior also. So they
Okay.
give supplements for that.
Right. Right.
They
Right.
may have anxiety attacks, so they give them anti-anxiety drugs. So, they treat the behavioral and the symptoms they observe. But there is no cure, medical cure for treating the autism.
Right. Right. Okay. Dr. Shilpa, how can parents control a child's maladaptive and self-destructive behavior who is having autism?
Fundamental, basically if you have observed the children with autism, they normally have aggressive behaviors when and maladaptive or self-injurious behavior. So why do they do that?
Right.
They don't know how to express, they don't know how to speak out their needs, their wants. So the first thing the parents need to do is to understand how well the child is communicating, and then observe what the child is trying to tell them by behaving aggressively, either towards others or by harming themselves.
Right.
So first thing they need to do is stay calm and observe the child and find out what is triggering the aggressive behavior in a child.
Okay.
So maintain a diary for a week or 2 weeks and note down the triggers and the what happened before and after each episode of aggressive behavior.
Okay.
So basically, because the child doesn't know how to express, child doesn't know what to, they want something, they need something, but they don't know how to express. So what do? They become aggressive.
Mm-hmm.
And when they don't know that nobody's there to listen, nobody's understanding, they become aggressive.
Right.
So if parents identify, keep observing a child and take the small cues of the behavior, they will be reducing the aggressive behavior in a child.
Mm-hmm.
So and first thing they need to think is, whenever child is aggressive, what is my child is trying to tell me? What does he want?
Trying to understand is very important.
Yeah, his needs, his wants, his feelings, and there are cues they can observe.
Mm-hmm.
For example, if the child does not like cornflakes, and if you give a pot of cornflakes with the milk in the morning for breakfast, how does child doesn't know how to express, child doesn't know how to speak, the language is not developed. So what will child do? The moment you put it, he will slap on your hand.
Okay.
So what is the child? Because what is he trying to tell you? I don't want it. Please take it away.
Right.
So the parents have to be very, very attentive to child's needs and wants. So that is how, if they become very attentive, if they understand what the child is trying to tell them, they will be able to reduce the behavior, like destructive behavior.
Correct.
And when they are not able to handle it, I think they should approach the professionals. They should take the professional.
Thank you so much, Dr. Shilpa, for sharing your significant information for autism, the viewers today. As a dedicated healthcare media platform through this initiative, we hope we are able to educate and aware people about the disorder and its treatment. Thank you so much for coming to our show and sharing your valuable
I'm sure. I hope that little information, whatever I've given, is helpful to the parents, basically.
We hope that too. Thank you so much, Dr. Shilpa.
Thank you.
Bye-bye. Have a good day. Have a good day.
Have a good day.